Let's talk about one of the most anticipated NCLEX maternity topic, placenta previa versus abruptio placentae. Placenta previa is a condition where placenta is low-lying. So ideally, normal placenta has to be interior and it does not cover the internal os, but in placenta previa, it is very low-lying that it might be covering even the internal os or the cervix. Now, in placenta previa, the major risk is bleeding. Placenta previa bleeding is painless and bright red blood comes out. Now, when it comes to nursing care, the most important one is there should not be any per-vaginal examination for these mothers, and a cesarean section might be anticipated or maybe needed, and also some of the women are put on bed rest, and we will be watching and monitoring for any signs and symptoms of bleeding. Now, on the other side, abruptio placentae is an emergency because this means that placenta has prematurely separated from the uterine wall even before the delivery of the baby. So ideally, when you look at the stages of labor, the baby should deliver first and then the placenta should separate and deliver. But in case of placental abruption or abruptio placentae, there is a premature separation. Now, this leaves the woman with painful bleeding. The bleeding is dark red in color and there is a huge rigidity in the abdomen, or you might even notice the question says board-like abdomen, which is directly signifying towards the placental abruption. Now, when it comes to care, you must monitor the bleeding, you must prepare for oxygen, IV fluids, blood transfusions, and most important, a cesarean section ASAP. So this is the difference between placenta previa and abruptio placentae. For more such videos, please consider giving a follow.